Hi everyone, good to have you here. This is a presentation on the statistical and clinical significance in nursing research done by Yvonne Givon and Ozibo Kelechi. So let's start by describing the two keywords involved. In research, statistical significance is a measure of the probability of the null hypothesis being true compared to the acceptable level of uncertainty regarding the true answer. It is assigned to a result when an event is found to be unlikely to have occurred by chance. In medical terms, clinical significance, also known as practical significance, is assigned to a result where a course of treatment has had genuine and quantifiable effects. When carrying out a statistical test, we found out that a probability, which is the p-value, is calculated and compared with the A level, usually 0.05 at 95% of confidence. If the p-value is less than the A level, the null hypothesis is rejected. And if the p-value is greater than the A level, the null hypothesis is accepted. For example, a nursing paper on the impact of junk food on hypertension is statistically significant if the study establishes that hypertension is mainly caused by consuming junk food. In other words, where we have the P to be greater than the A. Using the example above, the study is clinically significant if it can be applied to lower the rates of hypertension in a specific population. Now let's look at the importance of statistical and clinical significance. Statistical significance helps scientists, companies, and other entities understand how strongly the result of an experiment is. It equally influences their decisions. It helps to determine whether a clinical outcome occurs due to random chance or is caused by one or two factors. It equally helps to determine whether a treatment plan or a drug has quantifiable effects in alleviating an illness. It supports the idea that any difference between treatment is not by chance. Now let's look at clinical significance. This attempts to define the benefit to patients of any particular treatment. Clinically significant results are reproducible to a much higher degree than those which are merely statistically significant, and therefore they can be used in scenarios with higher stakes. It helps to make decisions on improving care quality. Sharing research findings with other healthcare practitioners helps to improve care quality also. On this slide, we want to look at some examples of statistical and clinical significance. Meanwhile, let's remind ourselves that a statistically significant difference means the researchers found an association or difference that wasn't solely caused by normal variation or chance. A clinically significant difference, on the other hand, means the researchers found a statistically significant difference that experts in the field believe is substantial enough to be clinically important. Now the examples. In the Conning et al. Study, which was done in 2018, the researchers focused on investigating the effectiveness of computed tomographic, that is CT screening, in the screening of and diagnosing of lung cancer. The study found that CT is statistically effective in screening and diagnosing lung cancer. The study is statistically significant because the value of P, which is at 0.01, is less than that of A, which is 0.05. In another study by Egan et al., which was in 2018, the researchers found that measuring and acting rapidly could aid in helping hypertensive patients improve their blood pressure levels from 61.2% to 89.8% during the first 6 months. This study is clinically significant because it offers a proven strategy to manage high blood pressure. So how do we utilize the differences in statistical and clinical significance while reviewing literature? To implement evidence-based practice, nurses must be able to comprehend and interpret research. That means one needs to understand the distinction between statistical significance and clinical significance. Although the two concepts are related, they are not the same thing. Statistical significance is established by an analysis conducted by researchers. Therefore, in literature review, we should take into account the design, the sample size, the effect size of the study, bias incorporated, and the reproducibility of the study while analyzing the study results. As aware researchers with logically and critically thinking minds, we are in the best position to evaluate research results and therefore applying them to practice evidence-based medicine or nursing. In conclusion, there is need to utilize the difference between statistical and clinical significance by becoming more curious when reviewing literature. Basing clinical findings on the statistics carried out by authors improve the reliability of arguments. We will apply this knowledge by ensuring that research projects are clinically significant. And lastly, we are open to your questions, your concerns, on whatever add-ons you have. Thank you for listening.